Good afternoon, everyone. I'm Cheryl Snyder, and I'm the Emergency Preparedness Coordinator for the town of Brookline. With me today is Sophie Gordon, who works with me on emergency preparedness activities. We're here to talk to you today about coronavirus and some ways that you can be prepared. First of all, what is a coronavirus? It's just like all the other viruses, norovirus, influenza virus. It is a virus that exists in the world and is currently affecting humans. It is not a bacteria, so antibacterial soap won't help. Coronavirus is named for the spikes resembling a crown that protrude from the surfaces of the virus. Coronaviruses have infected people or animals for thousands of years. Usually, they stay with the people or the animals and don't cross over from one to the other. But this one has recently crossed over and hasn't been seen in humans before. Coronaviruses cause respiratory illnesses. Symptoms can range from the common cold, which in fact is a type of coronavirus, to more serious symptoms. Covid19 is a particular coronavirus which has recently started infecting people. Before, it was a virus that was only seen in animals. Most respiratory viruses are transmitted through coughing or sneezing. So you don't want to cough or sneeze, particularly in public or around other people. You want to use your elbow to catch anything that might come from your mouth when you cough or sneeze. It is believed that the incubation period for coronavirus is somewhere between 2 and 14 days after the virus infects you. That's when you start experiencing symptoms. However, most people will experience symptoms by day 5. SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome, are two types of coronaviruses that have recently jumped from animals to humans in the last 20 years. So what are the symptoms of coronavirus? Well, symptoms of coronavirus look awfully like flu symptoms, but there are some differences. First of all, most people do have a fever. And also, there is a very dry cough, and usually there's shortness of breath involved in that. However, sneezing and runny nose, like a head cold, is not a sign of coronavirus. Gastrointestinal problems or diarrhea can sometimes happen, although they are more rare. Sometimes symptoms of coronavirus will progress to pneumonia. So you want to be very, very careful if you already have underlying lung illness. We don't want people to panic, because that won't help anything. Remember, COVID-19 is a respiratory disease caused by a virus, as is influenza virus. Don't let fear of what we don't know overwhelm what we do know. We know how to get prepared, and we know how to keep ourselves healthy. Don't let the constant media coverage cause panic. But do stay informed and up to date through trustworthy sources, including the CDC, the World Health Organization, and our own webpage on the Town of Brookline site. Sophie, can you talk to us about some prevention ideas?
Thanks, Cheryl. So there's many ways that we can prevent getting COVID-19. One of them is washing our hands a lot, washing our hands regularly and frequently. We recommend washing our hands for at least 30 seconds with soap, especially, after using the bathroom, before eating, before preparing your food, after blowing your nose or sneezing. If you go into a store and they have hand sanitizer, use the hand sanitizers. So any time that you can, wash your hands. We also want everybody to start practicing social distancing. This is very important to avoid crowds, to keep a distance from each other, at least 6 feet, so that if somebody coughs or sneezes, we won't be infected. Think about things you can do to avoid crowds. Maybe go food shopping when the stores aren't as busy. Maybe, watching Netflix instead of going to the movie theater. Another very important prevention is to stay home if you feel sick. We don't want people to be sick and go out and infect others. You need your rest to get better, and people want to stay healthy as much as they can as well. Like Cheryl has mentioned, coughing into your elbow or sneezing into your elbow is great. It prevents all the particles to go into the air. If you're going to use a tissue, dispose of your tissue right away and wash your hands again. We want you to avoid touching your eyes, your nose, or your mouth. It's really, really hard to not touch our faces, but this is something that's really important. We touch surfaces, and then we touch our faces, and then we get infected. If we have to touch our faces, wash your hands beforehand. As I said, with the surfaces, keep them clean. Using rubbing alcohol is a good disinfectant for coronavirus. Actually, anything that is recommended to prevent the flu works. So those Clorox wipes are great. And the last thing would be to get plenty of sleep, drink plenty of fluids, eat healthy foods, stay active, and manage your stress.
Thank you, Sophie. A lot of people have questions about masks. No one recommends wearing a mask unless you are sick. People who are well, who wear masks, may have a false sense of security that they are safe from coronavirus because they have a mask on. However, as we discussed, washing your hands is also necessary, among other things, including social distancing. So please, don't think that a mask is going to protect you. If you are sick, however, you definitely want to wear a mask so that you do not share droplets when you cough, sneeze, or talk. Also, specialized masks like N95s are reserved for healthcare workers and require fitting to your face and no facial hair. So, how can we prepare for coronavirus in our community? First of all, you want to make sure that you have 30 days worth of all of your medicines. Many insurers will now give you 90 days worth of medicine. You should ask for that. And if you can get them delivered to your home, even better. You also want to make sure that you have at least 2 weeks of food for you and your family. And don't forget your pets. If we need to stay home for a while because we're quarantined, we want to make sure we have enough food. You should also take a note that you need cleaning materials, hand sanitizer, laundry detergent, soap, things like tissues and toilet paper. You don't want to run out of those. Hand sanitizers should always have at least 60% alcohol. Make sure you have a plan to communicate with family members or neighbors in case you need help or assistance. Plan a support system for your children, your pets, or anyone else that you need to care for in case you get sick. Make plans in case an outbreak suddenly disrupts daily routines. What if public transportation needs to close? Or school? Or you can't go to work? You need to make plans for that now. Flu vaccine is highly recommended, as is vaccine against pneumonia, especially for older people. And unless necessary, now's not the time to travel. If you are told to self-isolate because you've come in contact with someone who might have COVID, please stay home. Self-isolation means staying away from other people. Don't have visitors, and don't go do errands. Call first before you go to the doctor or the emergency room to make sure they're ready for your arrival. If you live with other people, keep your bedroom door shut and stay there. You don't want to get the rest of your family sick. If you have a second bathroom, use that and have the well members of your family use the other. If you need to share a bathroom, let others use it first, and then you use it, and clean it well afterwards. Do not share towels. It would be very helpful if you could double bag your trash in case you are asked to self-isolate. Deliveries should be left at your doorstep, and once people leave, then you can pick them up. Sophie, what happens if I get sick?
Well, Cheryl, if you get sick, please stay home. Stay home, don't come to the office. And take care of yourself. Drink plenty of fluids. All right? If you do start experiencing high fever or shortness of breath, call your doctor immediately and let them know and listen to what they want you to do.
Exactly. Again, especially if you're sick, please don't go out. It doesn't matter whether you have the common cold, flu, or coronavirus. We don't want to share germs with everybody at this point. So please, stay home if you are not feeling well. We also want to remind everybody to be kind. As coronavirus has spread, so has anti-Asian prejudice around the globe, which is very unfortunate. Stigmatization can fuel the spread of an outbreak by driving vulnerable individuals to hide infection and avoid treatment, which we do not want to do. This is a virus. It does not discriminate, think, or plan. We should not blame a certain population because a virus started in one area and is spreading. Feel free to order out from your local Chinese restaurant. To stay updated, we strongly recommend that you sign up for Alert Brookline messages. These can be delivered via email, text, and phone. Go to www.brooklinema.gov/alert to sign up for these important messages. And don't forget about the CDC site, which has terrific information for many, many groups, including houses of worship, businesses, daycare centers, schools, families, and others. Please take care and help us keep our community safe. Thank you.